So the most challenging aspects of my job relate around two things. I'm educated as a healthcare professional, and I'm also running a business. And so the running of the business side isn't quite as fun for me, and therefore it's a little more challenging for me. I prefer to be in the clinic with the patients and treating them and helping them with better smiles. The other part of my job that I don't love sometimes is that we get varying levels of compliance with what we ask our patients to do. And so obviously if I ask a patient to wear a rubber band a certain direction, the faster they get done and the better the outcome. And sometimes their patients don't make that same connection, and so their compliance with what we ask them to do is less than optimal. I can tell because we don't get any changes in the direction we should get. When I see so many patients, I can see a patient that wears their rubber bands well and the result they get, and then I can look at a patient that isn't wearing their rubber bands and maybe is saying that they are, but we're not getting the results that we would expect from that. It's not super hard for me to tell whether they're wearing them or not. It's a little bit harder to the discussion of if I'm being told that they're wearing their rubber bands, how do I tactfully tell the patient and the parent that we're not wearing the rubber bands enough? So that gets a little interesting trying to broach that subject. I think those are exceptions to the rule, so that doesn't happen very often, but it's always disappointing when it does.